good evening, everybody. So, a few weeks ago, I had somebody requesting to have a talk on tinnitus, or ringing in the ears. And so, that's our topic for the new year. So, Happy New Year, everybody. So, tinnitus, it comes from a Latin word that means to ring. And basically, it is the perception of a noise when there's actually not a noise present in the room. Usually it's a high-pitched whistle, like a kind of thing, or sometimes it's a whoosh, 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 or a whoosh. And basically there's different kinds of tinnitus, different kinds of sounds that people hear. And the volume of that can vary over time, and also can vary depending on how much attention that we're putting onto the sound. Most of the time, tinnitus is something that's benign, doesn't really necessarily require intervention, but other times it is something that can be quite distressing to people. And so there's a lot of different options as far as things that people can try for it, as well as to see if there's something that is reversible that can be fixed for it. So it can be estimated that about 50 million people in the United States suffer from chronic ringing or whooshing in the ears. And by chronic, they refer to being about 6 months or longer. And about a quarter of those have it severe enough that it actually starts to interfere with their daily activities. It's more common in men than women, and it is also much more common with aging. And basically, there's some things that you can do early in life to reduce the risk of getting this as you get older. So as I was doing some research on this, it's kind of interesting. There's a lot of things where the tinnitus risk can be made worse with certain foods, such as foods that are rich in pollutants like mercury, canned tuna, for example. And also, there's actually some other medications that can also increase the risk for tinnitus as you get older. For example, there's a Medscape article that I found talking about the use of prolonged use of NSAIDs, in other words, Motrin, naproxen, in that category, and also Tylenol or acetaminophen, which is different than NSAIDs. And people that use those over the years, I believe it was more than 6 years and several times a week for most of the time during that period, actually was independently associated with higher risk of developing this tinnitus or this thing. And they were proposing that basically these drugs might impair your hearing function with the little cells, the hair cells that are in there. So what I mean by hair cells is we've got this really cool, awesome inner ear mechanism by which we can both hear things as well as get our position in space. And it's called the cochlea. Basically, it's 3 different, see if I can get this, interlocking rings. And maybe one day I'll bring up a little medical model I can show you guys. But basically, it's 3 different rings in 3 different orientations in space. And when you move your head, the fluid and these little crystals and these little hair-like things just kind of wave around in there. Which is one of the reasons why if you have somebody, I got a spinning chair here, so I'll demonstrate, and you spin them a lot, part of the reason we get dizzy with that is because we're kind of whooshing around this fluid on the inside of our inner ear, and it can give people some problems. At least temporarily. That's why it's fun, right? So anyway, so when the little hair-like cells that are helping us with our balance and our hearing and all that kind of stuff get disturbed, then they become more susceptible to, for example, noise-induced damage. So probably many of the youngsters these days that go around with the earphones in there, they're oblivious to the rest of the world and they're just kind of hooked up in their own music. Many of them probably have gotten the warning from the parents, hey, turn that down, I can hear you from here, and you're going to damage your hearing. And the kids are like, yeah, and that sort of thing. It's true, though. So part of the thing that makes it insidious, basically something that you don't notice right away, is that when the hearing is damaged by things like loud noises, you don't necessarily notice it at that moment. As a matter of fact, we actually have some adaptations to our hearing system, whereby if you're adapted to, or if you're exposed to a certain noise level for a while, it kind of self-dampens the perception of it a little bit, so you don't notice it being that noisy for a while. For example, if you go to a football game, I was well aware of this because I'm very mindful of my hearing, because part of my livelihood depends on, can I hear that really soft heart murmur or something, with the patient exam. So I'm very aware and try to protect the hearing. And so I go to these football games, and sometimes I would put my hands over here just to kind of block out the bring, 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 the cowbells and the roar of the fans and things like that. And after a while, I noticed, oh, well, if I take the hands away, it doesn't seem as loud. But you go away for a few seconds, you go back in that environment, and boom, you get that loud perception again. And so that happens when people are listening to music. It happens most commonly when people have little things in the ears and they just don't perceive it over time. Or sometimes if you're driving a car and you notice after a while the little knob on the radio is going up, because you just kind of get used to it. Kind of like you go into a room where you've got a strong scent. Boy, you really smell it that first moment, and then after a while being in that room, it just isn't quite as much there. So anyway, back to the tinnitus. So exposure to loud noise over a long period of time is actually the most one of the most common and most preventable kinds of tinnitus. So chainsaws, gunfire, loud music, going to a dance hall and hearing that loud music for a short while. Sometimes a short burst of loud noise can cause severe to profound hearing loss, pain, or basically feeling more sensitive to noises in general. So it's very, very common when people are working around airplanes, for example, or if they're working in places where they have heating and air conditioning systems, or other places where they're kind of in a small room surrounded by machinery and banging noises and whooshing and all sorts of things. Sometimes people forget to, or it's uncomfortable, so they're like, oh, why do I have to put the hearing plug in and then these big noise reducing things in and all that kind of stuff. Especially if you're working in a hot environment, you might feel sweaty or gunky or something like that. So sometimes people forget to, or purposely don't use their hearing protection. And since you don't notice it right away, you don't see how tough that is on the body over the course of a lifetime. So highly, highly encourage all of you to be mindful to, if you're going to be working in a loud environment, follow the instructions of the people that are setting up the safety standards, and please wear your hearing protection. Very, very important. And watch the volume, especially if you're using those little headphones a lot. Also, some of this tinnitus or things just can go along with getting older. Sometimes as people gradually get older, they start to lose some of their hearing, and as those little hair-like cells get damaged over time, whether it's from combination of a lifetime of loud noises, a little drugs, a little mercury getting in the food or something, whatever lifestyle or genetic influences that are going into it, and then over time they're like getting a little bit more hearing loss. Very commonly that abnormal perception of sound can go along with it. So there's other rarer things that occasionally can do it. Sometimes there can be ear disorders. The bones in the middle ear can get stiff. There are other medications that can cause problems with the ears as well. I'll post a link underneath so you can look at it later if you like, but I just want to make sure I don't accidentally say the wrong medication. Like, oops, but yeah, very certain antibiotics can be. Is it reversible? Asks JC. Well, it kind of depends on what the tinnitus is caused by. So if, for example, somebody has allergies and they've got some extra fluid in the middle ear, or has a bad cold or something and has something going on in there, then yes, potential that it can be reversible. In many cases, we don't really have a good answer for that, and we'll go over some different kinds of management kinds of things. But the real important thing first is to find out, well, what's the cause? What's the diagnosis? Have somebody actually look in the ears, get a hearing test, basically have somebody look around in there, and sometimes trying a few simple things like trying some allergy medications, trying some of the tips that are in my upper respiratory infection video with using cayenne pepper and other kinds of things to help decongest this whole area. Potentially it can be helpful if it's a fluid in the middle ear issue. If it's because of exposure to loud noises and genetics and getting older and all that kind of stuff, maybe not so much. But there are some really cool things that people can do to help improve those symptoms as well. The basic thing first is making sure it's not something more serious. Like very, very rarely, and this is the downside of things like, Medline on, basically people going and Googling stuff is, it can take something that's really, really most of the time, 99.99% of the time benign, and next thing you see is like, oh, what if there's a tumor of the otic nerve back in there, and next thing you know, you're scared that you got cancer or something. Most of the time, definitely not the case, but that's one of the reasons why it's important to, take the information on things like these videos and then apply it by talking to a live human being professional that can actually look around and look for things. So the hearing tests are very useful because they can tell you a little bit more. Where is the issue? Is it on one side? Is it on both sides? That sort of thing. And also help track things over time, because usually everybody loses a little bit of hearing, generally speaking, over the years, and so you can see, is it going down as you'd expect, or is it faster? It's a different scenario if stuff like that is happening in like a 7-year-old kid versus a 75-year-old, guy or something like that. So you think about different things depending on who it is and what's going on the person in front of you. So symptoms. So if this is a relation to just regular old age-related hearing loss, believe it or not, using hearing aids or other assistive devices can be very helpful, partly because it can magnify other noises around you. One of the problems with tinnitus that makes it annoying sometimes is that when we're out and about in the world, we're talking to people, we're doing stuff, we're interacting with the people and the objects around us, and we're distracted. And then you go to lie down, and all of a sudden it's quiet, and there's nothing going on, and then all of a sudden this noise or something, that's the only thing you pay attention to, because there it is, and so sometimes white noise machines that make a noise of the ocean or something else. Sometimes there's pillow speakers that people put underneath their pillow that play soft music or other nature sounds or music or whatever the person happens to like. Those kinds of things can be helpful. There are also these really neat hearing aid-like things that you can tell the person, basically they can tell what pitch or what tone the buzzing is, like, for example. and they can actually match the exact opposite wavelength. So you got your tone kind of being perceived at this wavelength, and then they match it with the same wavelength going the other direction, and then when the two things kind of pair up against each other, the result is silence, which is kind of cool. It's how those noise reducing headphones work when people are, you see them on airplanes and stuff occasionally. So it helps tune out some of the background noises in those cases. So there's some really cool technology stuff. Might be a little pricey, for example, but it might be worthwhile talking to an audiologist about whether that might be something that works in a particular person's case. For those that have VA benefits, I'm pretty sure that hearing aids tend to be covered by the VA, and I've met a few patients over the years that had that kind of technology, and I'm pretty sure it was through the VA. Don't quote me on that exactly, but so just something to talk with, again, people about. Sometimes there's cochlear implants. So this is the next level of invasiveness. So the little things that I was mentioning are things that are outside here that can be worn or used in the background to help distract or to help decrease the perception of the sound. Cochlear implants, they actually kind of get implanted back into the bones and like inside the head, and sometimes they are inputted into the inside of the ear, and they use electrical stimulation to kind of help improve the hearing. They sometimes can be used to help mask or decrease the abnormal functioning of those nerve impulses that are causing the brain to think like, wow, there's this noise there. And so that sort of thing may be helpful for some people. If you find that you're looking through your medication list and you say, oh shoot, this medication has hearing stuff or nerve damage as a side effect, in some cases stopping that medication can improve the tinnitus or the hearing going with it. So of course that also involves, please talk to your primary care provider, because some medications can be very not good for you if you stop them suddenly. So some have to be weaned off gradually, and others it's okay to stop it, but it's one of those things you need to definitely talk to somebody. So depression is very common in people that have tinnitus or this ringing in the ears, and sometimes if you improve the depression with antidepressants or other kinds of treatments like cognitive behavioral therapy especially, then you can make it so that the noise is not quite so troublesome. One of the beautiful things about the mind and our ability to focus on things and pay attention to things is that we have the great ability to be able to change what we focus on in a moment to moment. Like right now you're listening to my voice and maybe watching and that sort of thing. And so the mind is kind of distracted out here looking at the video and not listening to like the hidden inside noises, for example. So there's different kinds of things that can be done to help retrain that attention, and also to train the unconscious or subconscious mind to just not be quite so annoyed by the sound in the first place. And one of the things that happens is when we are stressed out or when we're upset by something or otherwise just very frustrated, then it has the power to just kind of magnify things and let out all the stress hormones and wire up the nervous system, and actually can amplify things. And so by practicing meditation techniques, for example, relaxation techniques, other things that can help release the worries and anxieties, by doing that, for many people, the perception of the buzzing goes down. And also because you're not sitting there buzz, 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 focusing on and getting, increasingly mad at and annoyed by and all that kind of stuff, the fact that this thing is happening and that alone can also help decrease the perception as well. I was just talking to somebody tonight who told me that they've had it for this ringing in their ears since childhood, and over the years they just have learned to kind of live with it, and they don't actually really notice it most of the time, unless something like tonight where we've got a conversation going on about it. So yeah, so it's interesting. So tinnitus retraining therapy is actually the name of that therapy, which involves retraining the subconscious mind to not be quite so annoyed by it, but associating the sounds as just natural, normal sounds that the body makes or perceives. And then there's masking devices. So these kinds of things are things like the white noise machine, having a radio on in the background, and that sort of thing. So when the tinnitus is really annoying in quiet environments, there's a technique that's popular on online, which involves essentially taking your fingers and doing some sort of drumming, and you do that like on the back of the head, something like 50 times. And they reported that that technique worked like for half the patients. And when I was reading a little bit more about it, there was a theory that maybe that was just kind of stimulating those nerves with just a manual vibration rather than some of the fancier kind of technology. So I don't really have any studies for it. I just kind of mention it because it's out there and people are probably looking online and finding it and saying, "Wow, what about this Reddit technique," as it were. So biofeedback is another thing that basically is, again, being able to reduce the stress-related symptoms. So when people are stressed out, their breathing gets faster, they breathe shallowly, their muscles get tight, and their perception of annoying things like tinnitus tends to get worse. And so using biofeedback and other techniques to reduce that body reaction can be used there. And there's a few other therapies that are out there. Some people talk about a few herbals. I don't really have any good experience with folks trying to cure or manage their tinnitus through it. So there's a few different kinds of things: electrical stimulation, acupuncture, repetitive transcranial magnetic stimulation is something some folks have tried, and some people are concerned that maybe some vitamins and minerals might be deficient, like niacin and zinc and copper, and so a few case reports here and there, people reporting that some of these things may be helpful for their particular case, but we don't have enough information to say broadly, for everybody. Generally speaking, I always recommend a good varied diet. The time that I tend to promote is the whole food, plant-based variety of that. Even Dr. Barnard, a nutrition MD, he didn't have anything specifically for tinnitus, but he mentions that some children with ear infections and ear infections were found to have low antioxidant levels, low zinc levels, and low iron. And so basically a whole food plant-based diet is really, really rich in all these macronutrients. Lay on the beans, for example, or the nuts and the seeds are really rich in a lot of these macronutrients. And so you don't have to take a pill, for example. Just a well-varied diet with lots and lots of plants in it should be useful for having all those necessary nutrients and reducing the reaction to allergies and stuff. Dr. Barnard did also mention in his article that because allergies are very prevalent and can sometimes be worsened by certain foods, in particular dairy products are very problematic for the sinuses and the ears, mainly because the same opiate-like compounds in the casomorphine increases the secretion of mucus in these areas. I used to think, it's just an old wives' tale when people say, you've got a cold, don't drink milk, that sort of thing. And then after learning about some of the studies that are out there, it's like, oh, okay, well, there's a reason for it. People call them mucinogenic foods because they mucus producing, forming foods, and it turns out, well, there's actually receptors, there's biochemistry behind it. Who knew? So I usually recommend staying away from dairy and dairy products in general, but it might be something to consider if you're having issues and you're finding that clearing out this area with allergy meds and other things is helpful for you, but that might be something to consider. All right, so that is about all I've got for Tinnitus Tonight. So the main article that I was using for tonight's reference was an up-to-date article, the Tinnitus Patient Information, and on the Facebook page I'll have that linked in the comment section afterwards. The Medscape article, hopefully I'll be able to put a link out there for you. If not to the Medscape article, I might just have to report the American Journal of Epidemiology December 14th issue, see if I can find a link to that. If it doesn't come up to be publicly available, then sorry, we'll have to kind of live with it, but that's the main other article for that. And then Dr. Greger's got a neat presentation on tuna and the increasing levels of mercury over the years, and that was a little bit dated. That was a 2012 report, but you know, I'm sure things are continuing to go in that direction. So anyway, thank you for joining us tonight, and we'll see you next time. Bye-bye. Oops. There we go.